Good morning and welcome to First Baptist Church for the third week of mental health in the church. I have the great pleasure of introducing Tom Eachus of Blackhawk Grundy Unity Point. He's director, has been the director at that fine organization for the last 25 years, I believe. I've worked with Tom for that time period. Doing my regular job as a probation parole officer. Tom is a preeminent voice throughout the state of Iowa when it comes to mental health, and he's been on the cutting edge of doing some things that has greatly increased the quality of life of individuals in our community of Blackhawk and Grundy and other points of the state. So, with great pleasure, I am introducing Mr. Tom Eachus.
Wow, with that introduction, Dwayne, I've got big shoes to fill, I guess. Good morning, everybody.
Good morning.
As Dwayne said, my name is Tom. I work at Blackhawk Grundy Mental Health Center. I've been at Blackhawk Grundy since 1988. What is that, about 33 years now? I tell everybody when I do presentations that I grew up in the place. My dad worked there for 28 years. He retired in 87. I came in 88. We never had a chance to work together, which is probably a good thing because we were pretty different people. But so Larry Ryan is our chief psychologist. Larry started in 1969. And I moved in his office when I was 11 years old, so I've been stomping around the halls of Blackhawk Grundy for now most of my life. I'm 63 and got a few years left. So I put in front of everybody, not that you're interested, but just some facts and figures, where we've been, kind of a timeline of our organization. There were a group of citizens in 1949 that got together called the Social Service Council. Some of you may remember the name Opal 4 or Judge Blair Wood. They were the founding members of our board of directors. We started out in business in 1950, and it's been an uphill climb since that time. We currently have an active caseload of people that come to our office for services of about 6,000, ranging in age from 4 to 84. Which should tell you one thing: mental health problems don't discriminate. Young, old, rich, poor, black, white, it really doesn't matter. Okay, thank you. So 1 in 4 to 5 Americans have a mental health problem in their lifetime. And let me differentiate real quick so I don't confuse people. There's a difference between mental health problems and mental illnesses. So any of us could have a mental health problem of some kind. If you get a divorce, if your kids end up in trouble with the law and there's stress in your life, if you move to a new community and don't know anybody and have some struggles acclimating to that community, anybody can have adjustment problems in life that cause some mental health type symptoms, depression, worries, anxieties, those type of things. We treat primarily people with mental illnesses. These are medical conditions that usually have some type of genetic or hereditary link. People don't wake up in the morning one day and say, I hope I hear voices that the FBI is out to get me. That's not normal. There's something hereditary or genetically going on in their brains that doesn't go on in the brains of other people. So those schizophrenia, bipolar disorder, major depressive disorders are mental illnesses, usually lifelong conditions that require some type of treatment and support and monitoring over the years. We can't cure those type of illnesses. We can control symptoms and allow people to function as independently as they can, recognizing that some of the mental illnesses like schizophrenia are very devastating to people's lives. If you've ever watched A Beautiful Mind with Russell Crowe, or another good one is The Soloist with Jamie Foxx. There's some great movies out there about mental health that really portray what it's like to have a major mental illness. Most of us grew up remembering One Flew Over the Cuckoo's Nest, which might have been what it was like back in the 60s or 50s before medications were invented, but not now. Things have come a long way since lobotomies of the 50s, 60s, and sometimes even early 70s. So we don't view the problems that we treat any different than if you went to your doctor and you say, "Doctor, I'm thirsty all the time. I got to go to the bathroom all the time. I sweat bullets all the time." And they do a urinalysis or blood test and probably say you have what?
Diabetes.
Diabetes. We don't stigmatize people with diabetes. It's okay to go to your doctor. I'm on insulin the rest of my life. I've just learned to live with it. But somehow with mental health, we still associate this stigma that somehow it's somebody's weakness, or they should just be able to pull themselves up by their bootstraps, or something bad happened to them. Mental illnesses don't develop because you were raised in poverty or because your parents were a little strict when you grew up. These are medical conditions just like type 1 diabetes. Best example I can give you, if you know anybody from Parkersburg, or if anybody's from Parkersburg, if you remember what happened in 2009, the town got blown away. They called a bunch of us mental health folks that do kind of debriefing stuff with law enforcement and EMS personnel and said, "We need you to come over and help talk to people about what they're going through." And when I drove into town that Saturday morning after the tornado on Friday night, the only thing that I can compare it to is the high school textbooks of history when we dropped the bombs over in Japan. That's what the town looked like. 80-year-old oak trees that were sheared off and looked like toothpicks. So we went to the VFW, which was one of the few places that was left standing, and the guy, I don't remember his name, but he'd point out people that he wanted us to talk to. And we didn't go over and say, "Hi, Bill, I'm Tom, I'm a mental health professional, and I'm here to help you." We said, "How's it going?" "Well, I can't sleep. I've had nightmares all night. I'm not hungry. I'm biting the head off my wife or my husband or my kids. I can't make a decision to save my life. I stand in front of the closet and I'm not sure whether to wear the red shirt or the green shirt." Those people are having acute stress reactions to the tornado. Had we not gone in there and talked to them about what they're going to go through and what they could do to recover from something like that, it would have morphed into something that we all know, which is called PTSD. Okay? So there's a lot of people in Parkersburg that never thought they'd have to go see a mental health person to talk about what they're still going through. That's fine. A lot of people just need education and support, which is one of the original parts of our mission statement, which was to provide education to residents of Blackhawk and Grundy counties about mental health, because there's a lot of misinformation out there. So we, like I said, probably 70%, 75% of the 6,000 people that come to our office on a regular basis have a serious and persistent mental illness. Our oldest client right now started with us in 1960-some, so that's what, we've known them for 60 years. Some people have seen, Dr. Flory or Dr. Lederman for 60 years for diabetes. Same thing. Some of them come into the office, they see their nurse practitioner or their doctor every 6 months to review their medication for depression, and then they go out and live their lives. Some people have very serious illnesses, everything, whether it's anxiety, depression, bipolar, schizophrenia. ADHD is on a big continuum. You've got people with serious problems that may need to live in group homes or residential care facilities that need that 24-hour-a-day structure, take their medicine, learn how to cope with life. You've got people with very minor problems, but still need some sort of treatment. The media has done a pretty good job over the last couple years of portraying mental health. Unfortunately, there's also the negative side of the media. So, some of us in this room are old enough to remember Mike Wallace, right, on 60 Minutes? Mike Wallace was treated for depressive disorder for 45 years. He took medications. He talked very openly about how his depression affected him, but yet he's able to show up on TV and have a good job. You've got people like, getting a little younger, Brooke Shields with postpartum depression. You've got people like Linda Hamilton, the actress that talks about bipolar, her experience of bipolar disorder. So some of the celebrities coming out saying, "I have this," makes it a little real. But then you've got some people on the other side, like one of the action stars, Tom Cruise, that says all of this mental health stuff is a bunch of hooey. I really don't know if Tom Cruise has ever met anybody with a mental health problem, but I'd like to introduce them to some people to tell them what it's really like. We got into a program back in 2006 called Peer Support, okay? So I can talk to people, and I've talked to people for 30-some plus years about depression and anxiety and schizophrenia and bipolar, but I don't know what it's like to have those symptoms. I don't know what it's like to have those illnesses. I don't know how to walk the walk. I can talk the talk because I know enough about them and have talked to enough people over the years to understand what it's like, but I don't know how they feel. Peer support people are people with lived experience with mental health that go through some training to become peer support specialists, paraprofessionals if you would. We opened a peer support recovery center, mental health recovery center in the Blacks building in 2006. We've since moved to the sign's still up there, it says Iowa Hospice on the corner of Commercial and 5th Street in Waterloo. There's a program there, we operate 6 days a week. It's for people with mental health problems, run by people with mental health problems, because they can say, I do know how you feel. I know what it's like to go through, and here's what I did to, quote unquote, recover to the extent that I can, to lead a life that has some purpose. Otherwise, many people with serious mental illnesses sit in their home, they smoke cigarettes, they die on average 8 to 25 years earlier than everybody else in life, and they have no purpose in life. We want to give people a purpose in life, to say, just because you have a mental illness doesn't mean your life is over. So over the last 70-some years we've been in business, we usually start our programs based on identified needs in the community. And right now, as you might guess, there's a lot of needs in the community. Right now, and I will put some of my last year's annual report on the back, we offer about 12 to 14 different services in Blackhawk County. We have a school-based mental health program. The schools, so let me back up a little. Most mental illnesses, 50% of all lifetime cases of mental illness will develop by the age of 14, 75% by the age of 24. So those of us over the age of 24 are probably safe from developing a mental illness, but we can still have mental health problems, mental health symptoms. So if you also listen to the fact that people start exhibiting symptoms 7 to 10 years before they're formally diagnosed or treated, we have a window of opportunity that we're missing. So 7 to 10 years, and 50% of them develop by age 14. Kids are in school at that age. So we started in 1990 providing mental health services in the schools in Waterloo. That program has grown to the point right now where I have 14 full-time people working in the Waterloo and Cedar Falls schools. The schools actually pay me to hire them. They know that if a kid has untreated mental health problems, that's going to interfere with their academic functioning, their ability to get along with people, their ability to solve problems. And if you don't know the consequences of not educating and not finishing high school, it's devastating. I mean, I can show you graphs, the trajectory for people that drop out of school for unemployment, underemployment, drug use, early marriages, early childbearing, legal problems. The graph just goes like that. So we want to keep kids in school. We may not be able to prevent them from developing a mental illness if they have a strong family history of mental illness, but at least we can mitigate the damage. We might be able to make some interventions that keeps the kid in school, allows them to graduate, treats their mental health problems, and help them function better. So, school-based mental health program right now is one of our biggest programs. We started in Waterloo in 1990, and we started in Cedar Falls in 2014, and that program continues to grow. Outpatient services, we have 17 therapists, give or take a few because I lose track, and 10 nurse practitioners that see people for therapy, counseling, prescribed medicines. We don't have anybody that lives at our place. They come in for appointments just like they do their primary care doctor. We developed in 2013 what's called an open access scheduling model. Here's how it worked before 2013. You'd call and say, I'm depressed, I want to be seen, I think I need help, and we'd say, great. I can see you on November 18th at 2 o'clock. How many of those people showed up? Maybe 30%. We wasted a lot of time. What we did in 2013, after about a year and a half of work with the staff and a consultant, we said, tell you what, Monday, Wednesday, and Friday from 10 to 12 and 2 to 5, if you want to come in and be seen, we'll see you. Okay? We'll get you into our system. You're not going to see a nurse practitioner. You're probably going to see somebody like me. I'm a licensed social worker. At least we get you into the system. It helps people come to treatment when they're ready. Not when somebody like Dwayne says, you're going to go to the mental health center whether you like it or not, and I'm going to lock you up if you don't. Those people don't usually even, they'll challenge Dwayne a little bit because consequences sometimes aren't as impactful as they maybe should be. But it's helped us eliminate a lot of wasted therapy time for people that aren't ready for treatment, that say, I don't know what I'm doing on November 13th at 2 o'clock, do you? You know, we live by our calendars. I can probably tell you in about 10 minutes what I'm doing, but it's helped to catch people when they're ready to come into treatment. About the time we did that, unfortunately, they'd come in and see me and they'd say, I need medications. And we'd say, well, that's going to be a chore. You know, I can see you on December 23rd. I decided back in 2011 when we got into the telehealth business that I was not going to be party to I know you're clinically depressed. I know you're thinking about harming yourself because you're so depressed, but it's going to be 3 months till I can get you on medication. Not on my watch. So we got into telehealth. I've had nurse practitioners from Florida, Arizona, Montana that see people over the TV, but access is better than no access. Okay, so we still have 4 telehealth providers that work for us, but I've also got 10 on-site nurse practitioners. If you need medication, I can probably see you in 3 to 5 days right now, which is better than I talked to a gentleman who moved to Missouri. It was one of our clients. He said they can see me in April, and a family member that moved to Colorado, and they had a 6-month waiting list to get into counseling. That's how bad it is in the United States right now in terms of getting access to mental health problems. So our outpatient program is very big. We have an outreach program for people with serious mental illnesses, bipolar, schizophrenia. Most of our outreach people are people that unfortunately end up in the Department of Correctional Services because of behaviors, untreated mental health problems. So their job, that team's job, is to keep people out of emergency rooms, mental health units, institutions, jail, and prison by helping them manage their lives. It might be monitoring their medication compliance on a couple times a week. There's 6 medications, and I'll get way in the weeds, for schizophrenia that come in an injection form. You get an injection once every 1, 2, 3, 4 weeks. Right now there's one that comes out, you get an injection every 6 months. It's slowly absorbed into your bloodstream and it's slowly secreted, so we don't have to worry about you taking pills. 90% of people with serious mental health problems go back to mental health units or emergency rooms for a couple reasons. Number one, they stop taking their medication. Why do any of us not take medications that we're prescribed? There's usually 4 reasons. Tell me.
We don't need it anymore.
We don't need it anymore. I'm better. It used to be you got, penicillin for 7 to 10 days. We felt better after 3. We pitched it away. Now they've got some of these magic antibiotics that work in 3 days. So I feel better. I don't need it anymore. I had a gentleman came in about 18 years ago. His parents brought him in. He said, those helicopters that fly around that hospital next to us, they're taking pictures of me in my bedroom at night and posting them on the internet. Now, we all know that's not true unless you're big into conspiracy theories, but he had a psychotic episode. We put him on medications. He came in 3 weeks later. He said, I don't need the medication anymore. The helicopters are gone. That's a wrong answer, okay? Now, I'm not going to say that somebody needs to be forcibly medicated the next 40 years of their life, but if you're doing well in 3 months, we'll talk with the doctor about cutting the medication in half, and then in 3 months, we'll cut it in half, and if you're still doing well, we'll take you off of it, but I don't stop medications. None of us should stop medications unless the doctor tells us. So I don't need it, is one. What else? Why do we stop taking medications?
Can't afford it.
Can't afford it. Shouldn't have to do that in this state right now with expanded Medicaid, but that still is a big reason people say, afford my medications. There's a lot of free programs and stuff, but unless people ask or go help people to do that, there's one big reason people stop taking medications. Side effects. Our medications have nasty side effects, so it takes a lot of work to work with someone to make sure that we minimize those side effects so they keep taking them. But that's why people go back to mental health units. They stop taking their medication. So we try to do that with people with serious mental illnesses with the injections. We have an integrated health home program. It's not a house, but it's a people with serious mental illnesses, in addition to their mental illness, the research would tell you they also have 6 to 7 chronic health conditions. And so if you're seeing 3 to 4 specialists in addition to your psychiatrist, I can tell you those doctors don't always talk to each other. So why are you giving them a medication that we just gave them, or why are you ordering lab work that we just had them do? So coordinating that stuff is the role of our integrated health home program. We are the mental health provider for Hawkeye Community College. I have a full-time licensed social worker out at Hawkeye Community College. I have 2 people, one that goes down to the Women's Center for Change through the Department of Corrections. She's down there twice a week, and then I have a full-time staff member down at the men's facility at the Department of Correctional Facilities, working with people on probation, parole, work release, going into prison or getting out of prison to help with that transition. We get some dollars from United Way to connect with people for the first time on the mental health units at both hospitals to help them understand what it's like to get into outpatient mental health services, because a lot of people fall through the cracks. You get a hospital, they make an appointment, you don't go to that appointment. Guess what? People relapse, they end up back in the hospital, so we try to stop that revolving door. There's some other programs I'm forgetting right now, but those are the primary programs we offer. We started serving Grundy County in 1964, so we have a social worker that goes down there every Monday, and a nurse practitioner that goes down there 3 times a month to see people from Grundy who can't drive to our office, although we ramped up during COVID with telehealth. Right now, any staff member, from the secretary that answers the phone to the nurse practitioners, can connect with people anywhere, anytime, with about 5 different virtual platforms. So the people that are isolated but at least have internet access, we FaceTime. We don't use FaceTime. We use Doxy, Doximity, video, Zoom, Teams. We use any process we can to connect with people the way we can, so there's at least that access. I hate to stand up in front of groups and lecture for an hour, so I'm going to be quiet for a minute. What questions do you have? What have you heard? What are you wondering about? I'm open to answering anything about any topic mental health related if I can. Before I forget, in the back, one of the things Susan asked me to do was talk about resources in Blackhawk County. Iowa still is a very rural state. Most people with serious mental health problems tend to gravitate towards larger communities that have more resources. Waterloo, Cedar Rapids, Davenport, the Quad Cities, Des Moines. We have 2 homeless shelters in town. We've got a very rich human service delivery system that takes care of people. Operation Threshold, the food bank. We work very closely with those organizations, so people tend to come here. It's hard to get a lot of services when you're living in, Pocahontas, Iowa, that is not the hub. Some people in Iowa have to drive 2 hours to go see their psychiatrist. That shouldn't happen with COVID. Most people have telehealth options available to them, but access and availability of services are 2 of the things that we focus on a lot in our community. I said I'd be quiet and answer questions, so I'm going to be quiet. Questions people have, things you want to know about?
Tell us a little more about the mental health in schools.
So, we're seeing more of it since COVID. There's some kids that have never set foot in a classroom because, school basically didn't function last year, and this is the first time they're going, and so learning to get along with other kids. There's a couple transition periods when kids go into kindergarten. The transition from junior high or middle school to high school is a tough transition for kids. And then the transition from high school into what? The working world or community college or college are a difficult transition. So we're seeing a lot of anxiety. We're seeing a lot of depression. We're seeing a lot of grief. People that have lost family members to COVID, friends. We're very worried right now. The initial statistics say that the suicide rate has not increased, but I'm holding my breath. Historically, anytime there's been a major downturn in the economy or any type of public health crisis like SARS or the bird flu or the Great Depression or some of those situations, we've seen a corresponding increase in the suicide rate in the United States. The pandemic isn't over yet. I wish it was. I'm tired of wearing masks like the rest of you. Right now, the preliminary data, which is usually about a year behind from the Iowa Department of Health, Public Health, has said they haven't seen the blips with the suicide rate increase. That's what I'm very worried about in schools. So we're seeing many more kids referred just to deal with the stress associated with school. You've got the kids with ADHD and the kids that develop behavior problems. Again, if they don't stay in school, the outcomes are more negative than if they did with problems. So we try and address those problems, keep them in school, keep them in classes, learn how to cope with, you know, the social aspects or how to deal with their emotions. But we're seeing a lot of I've got 14 counselors and they've all got caseloads of 40 or 50, and we've got our fingers in the dike and the water's coming over the top of the dike. So we're looking for 2 more school-based therapists. We just got a federal SAMHSA grant to expand school-based services and some other services that we provide. So lots of problems. So we also do a lot of teacher education. We do a lot of communication and coordination. If a kid is on a medication by their primary care doctor and they're on juvenile probation, and they've also got some DHS worker working in the family, you've got a bunch of systems working together, and we try to tie all those together so the right hand knows what the left hand's doing, which is sometimes a challenge in this world. Other questions? Otherwise, I'll keep talking.
Why Grundy County? I mean, and there's a lot of counties around. Why was it Grundy County?
You know, back in '64, I think somebody said, you know, maybe we need some mental health services down here, and I think we started going. I don't know really what the connection was, but we did it for 10 years, and then there was an formal affiliation. We changed our name from Blackhawk County Mental Health Center to Blackhawk Grundy, very unique. We did some consulting work when the Cedar Valley Mental Health Center closed back in, early 90s. We did some work when the mental health center down in Toledo closed, and we thought those counties might want to join us, because some of the mental health centers in Iowa serve 6, 7, 8, 10 counties. How we ended up with just Blackhawk and Grundy County, luck of the draw. There's really one of the problems in Iowa is we've got 99 different little jurisdictions. You got 99 sheriffs, you got 99 clerks of courts, you got 99, so there's been a lot of consolidation. The first judicial district, both juvenile and adult corrections, probation, comprises the same counties, but the map for mental health services in Iowa is all over the place. So, but counties usually affiliate with some sort of mental health center or mental health provider. We've got a lot of resources in Blackhawk County. That was what I was going to mention. There's a website called Cedar Valley Connections, but it's very out of date. It can be out of date tomorrow if you look at it. It lists all kinds of mental health resources in Blackhawk County, the people providing mental health services, but there's new people cropping up, new agencies every day. So about the time they update that list, it's out of date. But we aren't the only game in town. We are one of the 3 or 4 what I call psychiatric providers. We have staff to prescribe medication. You can go to a lot of counseling agencies, but if you need medication, they're going to refer you to either us, Mercy One Behavioral Health, which is up the street on St. Francis Drive, Unity Point Clinic Psychiatry, which is over in Cedar Falls, and the VA out at on San Martin has a prescriber if you're a vet. And then you've got People's Clinic that's getting into the mental health business. They have nurse practitioners. And then this new animal called Elevate CCBHC has a nurse practitioner. So there are a lot of agencies, actually Cedar Circle, which is a mental health agency out on Green Hill Road, has 2 nurse practitioners. So people are understanding that if you just need counseling alone, that's fine. But if you have a mental health problem that requires medication, you don't want to go to 18 different agencies. So it's changing every day. What we'd really like to do, and what's been my dream for a lot of years, is the research tells us that primary care providers in the United States prescribe 60% of all the psychiatric medications in the United States right now. Fine. I don't have enough psychiatrists. Iowa's 47th in the United States in having enough psychiatrists. We're terrible. I don't have a psychiatrist. I haven't had a psychiatrist since 2000. I had one. I haven't had a full-time psychiatrist since 2014. Our part-time psychiatrist retired in May, and our other part-time psychiatrist that was doing telehealth for us from her home in Texas had other responsibilities, and so she had to step out in August. So I have no MDs on site. And where was I going with that? I'd like to know. So if 60%, if most of us have a problem, can't sleep, lethargic, a lot of somatic complaints, all of which are symptoms of depression, we go to our primary care doctor, and the primary care doctor gives you a PHQ-2 or a PHQ-9 and says, I think you're depressed. I want to prescribe Prozac to you, and Prozac works. Fantastic. It's only when medications don't work or PCPs have exhausted their experience. They aren't psychiatrists, they aren't mental health professionals. They don't necessarily like to treat the bipolar disorders and the schizophrenic or the psychotic disorders, but run-of-the-mill depression, anxiety, they're very good at treating. But what I'd like to do is put somebody like me in the big place like Prairie Parkway, where instead of having to go to one of these agencies across town, you go down the hall. We did that out in Evansdale with a pilot project for a couple of years. I was out there for a while, and instead of Dr. Stinger saying, Dwayne, I'm going to refer you over to Blackhawk Grundy. I know you don't have transportation, and now you're working full time, and they're only open until 5 o'clock at night, so I don't know what you're going to do, but you got to go see them. Rather than, Dwayne, come on down the hall, I want to introduce you to Tom, and Tom's going to hook you up and see what he can do to help you out. That's what I really want to do. I want to put about 14, 15, 20 different therapists and or nurse practitioners and primary care offices, especially the big ones like Prairie Parkway, where there must be about 175 doctors, I guess. Just lots of providers where rather than having to send people to different places, it's one-stop shopping, which would be really cool. What else do you got? What other questions?
Are you aware of any preparation that's going on at the college level with psychiatrists and mental health?
Well, we've got a psychiatric residency program at the University of Iowa. They churn out, I can't remember how many people graduate from that program every year. As Dwayne said, I'm pretty opinionated. I've stuck my foot in my mouth several times over the years, one of which was with Iowa City. A couple years ago, they did some research. Out of the last 86 graduates from their residency program, people that became psychiatrists, only 4 of those people were from Iowa, and only 2 stayed in Iowa. So why is a publicly funded university taking people from out of state? And I know there's a matching program. Any of you that have family members in the medical business, there's a matching program that's very complicated. I understand that. But we need help in Iowa. And to take people from out of state knowing full well they aren't going to stay in Iowa is a kind of a crime. University of Iowa also does a ton of research. And what they do is they hire a lot of the psychiatrists that graduate from the program to do research. Fine. The day they cure schizophrenia is the day I'm going to be like Dwayne. I'm going to be digging in the dirt and get my master gardener type of certificate, because that's what I enjoy doing. Either that or I'm going to volunteer to mow the lawns for the city of the Waterloo, because I like mowing lawns. That's my mental health. But right now, I'm a little upset with Iowa City that they haven't listened to the concerns that are going on in the state, saying we need more help. So we're trying right now. I've learned over the years from trying to recruit psychiatrists, psychologists, mental health professionals, unless you got a connection to Iowa, you aren't coming here. We have the lowest reimbursement rates in Medicare and Medicare in the United States, and that was with having Senator Grassley and Harkin on the two biggest, most powerful lobbies in committees in DC, and we still couldn't get the reimbursement rates. Most people, I can tell you right now, in general, if a healthcare system would hire a psychiatrist today, they'd probably start at about $300,000 a year, which to me is a lot of money. You can go to the coast, West Coast and East Coast, Chicago, Atlanta, and probably make 3-4 times that amount of money as a psychiatrist. So people aren't running to Iowa to work. We try to grow our own. There's a residency program between Allen and Mercy that just kind of split off, but we try to talk to those residents in medical school while they're trying to decide what type of doctor they want to become. The nurse practitioner program in Iowa, Allen churns out 14 a year, and all 14 of those have 4 to 5 job offers by the time they graduate from school. I like nurse practitioners. They're very good. They used to be nurses first, so they know how to relate to people. Not that psychiatrists don't, but they have more training in working with people, nurses by the bedside. And most of the nurse practitioners that I work with will tell you I'm not a doctor. I don't have an MD, so there are some problems that are very complicated that need to be seen by a physician. So sometimes people do end up going over to Unity Point Clinic Psychiatry or Mercy One Behavioral Health up the street because they have psychiatrists. I don't at this present time. We're supposed to be getting one next July from North Carolina. He's signed a contract with Unity Point to work for us. So I'm looking forward to that day. But we're doing the best we can to grow our own, even mental health professionals. I've been looking for people like me with an LISW, licensed independent social worker credential, for most of the last 20 years, and they just aren't out there. I don't know where they're going, but we take BA level students and hopefully they go on to get their master's degree, and then we offer them internships as a master's degree, and then they get their provisional license. We supervise them for 2 years, and hopefully they'll stay after they graduate, but it's hard. We got to grow our own right now. So not sure if that answered the question, but that's the best we're doing in terms of preparing people to go into the business. What other questions you got?
What about the police force and the firemen?
In terms of their mental health or us helping them?
You helping, well, both, I guess.
Yeah. So we used to have in town, in 1990, there was something called the Cedar Valley Critical Incident Stress Debriefing Team. Anybody that has EMS personnel in their family background, and their families, firefighters, paramedics, first responders, or police officers, they are unfortunately the de facto first responders for a lot of mental health crises. But they usually go out to car accidents and fires and that kind of stuff. Those people are wired a little differently than the rest of us. So when we all remember 911, when the towers came down, most of us were running away from them. They were running towards those towers for some reason, because that's what they do for a living. They have a lot of strong emotions when they can't fix things, when they can't save people, when bad things happen. So we started doing debriefings with them, kind of like we did in Parkersburg with the tornado. When something bad happens, usually, like Chief Fitzgerald or Pat Treelor with Waterloo Fire Rescue will call and say, we need a debriefing. We go in and we talk about what happened, we talk about the emotions they have, we talk about what they can do to recover, to get back to doing their jobs better, and we send them out the door with some resources. That's helpful. We used to do those very regularly. In 1993, when I joined the team, my wife asked me if I had a full-time job, because we were going out every evening and weekend doing debriefings with small-town fire departments and law enforcement. We don't do much of that anymore because they debrief themselves, but we've also moved that into the business world. If a forklift kills somebody at John Deere or Target Distribution Center, somebody walks in with a gun, all of us have strong emotions. We go in and do some of those debriefings. So we continue to provide that service to firefighters, EMS personnel. Elevate CCVHC has some social workers riding along with the Waterloo Police Department, which I've wanted to do since 1988 when I walked in the door at the mental health center. It costs money to do that. Nobody's been willing to fund that, but Polk County started doing that in 1993, and what they found was the average response time for EMS personnel to be with a mental health client that they get called on went from hours down to 23 minutes. So what they do is call, say, I've got Bill. Bill is exhibiting some mental health symptoms. The police say there's been no crime committed. They hand them off to the mental health people and we take it from there. So it lets police officers and EMS personnel go back and do what they were trained to do, which was protect and serve and help people. They let us deal with the mental health. So I haven't heard too much about how Elevate's program's going with the cops, with the police department, sorry. But that's something that we're hoping to do with Waterloo Fire Rescue, because I did not know until 3 years ago. The fire department doesn't get paid unless they transport somebody to the emergency room. We've all been told over the years, don't go to the emergency room unless you have a real emergency. So there's a lot of people that they get called out on that have mental health problems that don't need to go to the mental health, don't need to go to the emergency room, but they don't have any other options. There's a pilot program from CMS at the federal government said if somebody like me who's a Medicare provider goes out with them and says, I don't think Bill needs to go to the emergency room, I'm gonna talk to the doctor, we're gonna do something with his medication, we're gonna follow up with him tomorrow. The fire department, the ambulance service gets paid, the client doesn't have to go to the hospital, we all save money and the outcomes are better. We weren't able to qualify for that first pilot project from CMS with Waterloo Fire Rescue. You had to transport a minimum of 14,000 people a year. They only had 9,000 transports in Blackhawk County. But guess who pays for some of that stuff when they don't have any money or any insurance? We do, through our taxes. So again, there's some benefits to doing some of those things with law enforcement and EMS and paramedics and firefighters and that kind of stuff. So we're trying the best we can. We do a lot of education. 3 months into COVID, Evansdale had me come out, and we work with all the small fire departments and EMS personnel, and I spent about 3 hours out there doing some training in terms of what they were gonna see, how to respond to people that they get called on with mental health problems. So we still do a lot of education and training if we can. Thank you for that question. What else you got? What other? Yes, sir.
Do you, counsel or do you recognize people who are victims of crime that, in terms of mental health?
Yeah, there's a program in Iowa called the Crime Victims Assistance Program. So people that are victims of crime can apply to that program. If they don't have any money or any insurance, it will pay for counseling, it will pay for medications. So yeah, we see a lot of victims of crime. We work with Waypoint, the domestic violence agency. We work with Cedar Valley Friends of the Family. We work with the other group I'm drawing a blank on right now with domestic violence and sexual assault. We do a lot of mental health counseling for those types of people that are victims of various types of crimes, assaults, rapes, domestic violence, and those types of things.
Tom, can you explain a little bit about the Adult Crisis Stabilization Center and how they are not figured into that 14,000 or above there, and how that's used rather than the emergency room there, which is a huge savings for any community that has that?
Sure. So Blackhawk County for many years has had, it used to be the youth shelter out there on Dunkerton Road, just next to the old care facility. They had a detention center and they had a youth shelter. The detention center had like 30 beds. As Iowa got away from institutionalizing kids or detaining kids, even if legal problems, that place downsized dramatically. Right now they've got 8 beds set aside for delinquents in the juvenile justice system, and the other half of that building out there became what's called an Adult Crisis Stabilization Center. You're having some symptoms, you don't need to be in the emergency room, but it's not necessarily best for you to stay in your own house or apartment. So let's go out there, let's deal with the crisis proactively, let's have you in a safe environment where we can look at your medications, get some services arranged, and then in a couple days, 1 day, 2 days, 3 days, 5 days, let's get you back to your residence with those services in place so we can avert further crises. It's worked quite well for a lot of people, that it's kept them out of the emergency room. It's very expensive to go to the emergency room. It's also very traumatizing. Alan decided years ago, they have 5 rooms in a separate part of their emergency department for people with mental health problems. Because even right now, if you go into the emergency room in Allen, you have a gunshot, you're a victim of a car accident or a heart attack, you're triaged first. It doesn't matter whether you're depressed or anxious or some other types of mental health problems. They're dealing with the acute medical problems. But they have 5 separate rooms in the back of the emergency department, staffed 24 hours a day, 11 hours a day with a mental health professional, and staff that are specially trained in mental health to take care of those patients, rather than mixing them in with heart attack victims and gunshot victims and car accident victims. So it's worked very well to separate those people. Covenant Mercy's got 4 beds in a little different area of their emergency department, again, knowing that people with mental health problems need to be treated a little differently than other folks that don't have mental health problems. So the crisis center has filled a void in terms of keeping people out of the emergency room, keeping them out of the mental health unit. It's less expensive, it's more quote-unquote humane. Not that the hospital EDs and mental health units are humane, it's just more homey as opposed to an institution or a hospital emergency department. So it's been a nice addition to our service delivery system, our levels of care in Blackhawk County. Other questions, comments, concerns, rumors you want me to talk about, anything? Yes, sir.
One more, the Waterloo schools used to have a systematic way of dealing with incorrigible youngsters. Is that program still there?
Yeah, they've still got the kids whose mental health and or behavior or emotional problems lead them to not be able to function in the public school setting, go to a program called Expo. It's over at the old McKinstry, thank you, over on Independence Avenue. Expo, it's the alternative high school, and it's not a school for dropouts. They have the same type of rigorous study, it's just they're treated a little differently with some additional supports. I haven't heard the word incorrigible for a long time, but we used to use it years ago when I was at MHI. Dwayne's nodding his head, that's a term. Right now they've got a system, it's a triangle. They've got a PBIS system in the schools. About 10 to 15% of the kids are going to have this high level needs, and that's the focus of interventions, whether it's us or substance abuse or medical. Then you got the kids in the middle. Then you got the lower level kids that might need some help, but they don't need mental health professionals, so they use that triangle in schools to try and identify kids with special needs and wrap services around them. But yeah, some of us still know the word incorrigible, and there's still some people.
Is there still a connection with that kind of a program and the schools in the people in Eldora?
Dwayne's got to help me here. If you have legal problems as a juvenile and you can't make it on juvenile probation and the services they've got arranged, you may end up in Eldora. They've got a school in Eldora, they've got recreational facilities, they've got job training programs. But yeah, that's usually based on the legal offense. The legal offenses that kids might be convicted of. Yes, ma'am.
Is there assistance for families of the children who are having?
Oh yeah, I mean, my second job out of my VA program, and after I got my master's degree, was at the Cromwell Children's Unit at MHI in Independence. Kids stayed down there for upwards of 4 months, sometimes longer, who had emotional and behavioral problems. excuse me, you can do a pretty good job with the kids, but if you don't do something with the family and the environment at home, you're sending kids back to the same environment that they came from. So part of my job was to work with parents and families and communities to make sure that resources were in line with what we were trying to do at the children's unit when we had the kids for 4 months. So if you don't work with the families of kids in schools, and we do a lot of work with the parents and the families, you're basically just, pardon me, throwing water down a rat hole. You can maybe help the kid develop some coping strategies to deal with whatever might be going on at home, abuse, domestic violence, absent parents, drug usage, but you really have to work with the system. It's not an individual type of thing. So yeah, there are a lot of resources.
What connections do the programs here in the Waterloo area have with MHI, for example?
Well, since I worked at MHI off and on for 6 years, I tend to pull rank. So when I left MHI in 1988, we had 400 patients in the hospital. Those of you who've been around for a while remember in the heydays in the 60s, they had 1,500 patients in the hospital down there. First medication came to the United States in 1955. The second one, lithium, came in 1963. And the deinstitutionalization movement of the 70s dumped a whole lot of patients out of the hospital in the communities. Unfortunately, there was not a lot of money that was transferred from those savings into the community. So that's where the homeless population came for. That's where the revolving door in and out of the jails and prisons came from, which still unfortunately goes on today. Right now there are 40 adult patients at MHI and Independence.
How about youngsters?
Youngsters, they have a PMIC program down there that, if I recall right, has about PMIC, Psychiatric Medical Institution for Children. It's an acronym that they use in the state. It's an inpatient residential setting for kids who have serious mental health problems. I believe they have 30 beds down at MHI for PMICs. There are other PMICs in the state, but that's going on with the kids right now. They do have an adolescent unit. I don't know how many patients are on the adolescent unit right now, but 15. But people ask me, so from 400 down to 40, where'd the other 360 go? Some of them are living in the communities fairly successfully with the services the Dwayne's organization, ours, are able to offer to them. Some of them ended up in residential or group home settings. Some of them ended up in jail or prison, and some of them are in and out of homeless shelters. It's been a struggle. You know, if the state would have said, we're gonna cut the number of beds by 360 and the $20 million that we're gonna save by doing that, we're gonna shove into mental health services in the community, I'd have said, I'm all for it. But the state hasn't done that, unfortunately. They've transferred that savings into other areas. Right now, what was the thing in the paper last week? Iowa's got a $1.4 billion surplus and they're gonna cut taxes. I'm all for cutting taxes. I pay taxes like the rest of you. But I also know we're dying on the vine in terms of addressing mental health. And it's like the old balloon. If you squeezed on one end, the air's gonna go the other end. If we can't see people when they need to be seen, they're gonna go to the emergency room. They're gonna end up in the mental health unit. They're gonna end up in jail. They're gonna end up in prison. So our job and my job for 32 years is to stop that cycle if I can, by providing access and available services wherever I can. It's a struggle, but we're doing the best we can with what we got. So, Dwayne, have I talked enough?
I have a question.
Yes,
Do you
ma'am.
think- Do you think the way that we raise our children today have anything to do with more children in trouble?
You know, I've heard over the years the disintegration of the nuclear family. It used to be mom and dad and 2 kids, and the grandparents were involved, and aunts and uncles and cousins. We've become a very diverse society. I do think there's probably some research out there, but I haven't read it, that some of the changes in society have contributed to some of the problems that we're seeing right now. I know a lot of you are probably older than I am. I don't ever recall seeing a time where we've been so at each other's throats about a lot of the stuff. Whether the pandemic started that, Why we politicized everything, I have no idea, but it's hard not to turn on the news and see some sort of strife that has to trickle down to kids. I mean, fortunately, my kids don't watch a lot of news. They know what's going on. There's something on the internet called Reddit. My son's an avid Reddit fan. He knows everything about everything, but it's more objective as opposed to the various viewpoints. I think there's some validity to that concern. I just haven't had enough time to sit down and read as to why, and the bigger problem is what are we going to do about it if it is true, you know? So we become a very mobile society that lives for the moment, and I think looking long term, we need to do some work in those areas. So,
Do you think that a lot of our problems in our society today are because we overthink every problem that comes down the pipe?
probably. I'm a pretty black and white thinker. I don't have a lot of time in my life to figure out why and what for. It's like I got a problem in front of me, I need to fix it. So I operate on a fly by the seat of my pants, trying to make decisions. Sometimes they're life and death. You know, somebody calls me and says I'm going to kill myself. I don't want to think about that. I want to get EMS rolling up to that person's house and try and save their life, because there's been occasions in my career where that's not happened, and those are the things you remember for the rest of your life. So I think we overthink a lot of stuff, but God bless the politicians that get to do that stuff, because I wouldn't have the patience to do what, you know, Bob Kresick or Timmy Brown or any of those people do. Even city council people, that's got to be a tough road to hoe. So they have more patience than I do. I need to get things done. So I appreciate everybody attending. Yes, ma'am.
What about the rumor of both parents working, making it even harder on everybody else? I mean, their kids and stuff, you know?
Yeah, and I think right now, unfortunately, I think there's a lot of people would say that both parents have to work in order to survive financially. Doesn't mean that the quality of child rearing or child care or family relationships has to suffer, but it's tough. My wife and I both worked. She actually worked at the mental health center for 16 years. She was the office manager. So when they said the Eachuses run the mental health center, we did. And what we found is she was getting to work at 7 in the morning. I got to work at 5 in the morning. We'd get off at 5, still have to deal with the kids and sports and band and that kind of stuff. And we found ourselves at each other's throats, and we said, this has to end. So she quit 10, 12 years ago to quote unquote take care of the kids and their schedules, take care of me, take care of my 90-year-old mother that lives at Friendship Village and her 92-year-old mother that lives at Friendship Village. So her full-time job is to take care of us, but we still try to do those things. But it's tough for parents, both of whom have to work and still have to come home and find the energy to do the kids stuff. So it's something that people have to make a dedicated commitment to, but it's stressful out there. I just got through talking to all the court officials that Dwayne and I work with at their professional development last week, and we talked about stress for an entire hour. Because if you're not stressed, I'll probably find a way to tell you that you are, and the biggest thing is, what are you doing about that? And if A, B, and C doesn't work, you better have D, E, F, G, H, I, and J in the background, because not everything you do every day will work. I'm like Dwayne, I like to go out and dig in the dirt. In fact, this afternoon, I've already filled up my yard waste container. Now I'm going to borrow my neighbors and keep digging weeds and cutting back flowers. And the leaves haven't dropped on my maple tree yet, but they'll drop after they close the leaf dump, so I'm in big trouble. So thank you for your time and attention this morning. I appreciate it.
Thank you.
I would like to thank Tom Eachus from Blackhawk going to Unity Point. It's always been an inspiration to me, and one of the people that I met early on in my college days, you never know how those individuals will come back around in your life. You know, he's the tip of the spear when it comes to mental health in the community and the state of Iowa. And you know, hopefully you guys learned some different things today regarding mental health in the community, how we should access it, how we should help others access mental health in the community when they're in need there. And just like I always say, recognizing is everything. So thank you for coming today.